Hello, in this video we'll be discussing medical necessity. So what is medical necessity? Well, it's the reason why a healthcare service or treatment is performed. The standards of medical necessity must be met in order for an insurance company to cover a healthcare service. So in order to be medically necessary, a service must meet the accepted standards of medicine, and it must be used to prevent, treat, or diagnose an illness or injury, condition, or disease. In other words, a service or procedure must be medically necessary or it will not be paid for by the patient's insurance company. The link between ICD-10 CM codes and medical necessity is extremely important to understand, because if a healthcare treatment or procedure does not have medical necessity, then insurance again will not pay for it. In other words, the diagnosis code is the medical necessity for the service. It should also justify any procedures that might be performed. An example of this, let's say a patient had an appendectomy. The ICD-10 CM code should indicate the reason why the patient had the appendectomy performed. Normally, that would be appendicitis. The importance of medical necessity and medical coding all relates back to medical necessity and documentation. Medical necessity documentation, or lack of it, is one of the most common reasons for claim denials. Again, for a service to be considered medically necessary, it must be reasonable and necessary to diagnose or treat a patient's medical condition. When submitting claims for payment, it is the diagnosis codes reported with the service that tells the payer why a service was performed. The diagnosis reported can be the determining factor in supporting or not supporting the medical necessity of the procedure. So another example of this, let's say a patient came in with an earache and was diagnosed with otitis media, and the provider billed for a chest x-ray. Well, insurance isn't going to pay for that. This is because it's not medically necessary to perform a chest x-ray on a patient who is not having any breathing or chest-related symptoms or problems. Understanding and determining medical necessity can be very confusing for physicians, coders, and billers. A physician may have a completely different understanding, interpretation, or definition of medical necessity than the patient or patient's family member. And then a third-party insurance payer may also have another completely different understanding and application of the term. Remember, the diagnosis drives medical necessity. Coders need to understand the diagnosis itself, as well as what services or treatment options are available to the provider. Medical necessity can be confusing when it comes to who is going to pay for the procedure. Many third-party payers have specific rules regarding what they consider medically necessary. Third-party payers may have a specific exclusion for procedures that they consider experimental, unproven, or cosmetic. Even if a particular procedure or service is considered medically necessary, some payers impose limits on how many times a provider can render a specific service within a specified time frame. So for Medicare and Medicaid, these limitations are known as National Coverage Determinations, or NCD, and Local Coverage Determination, or LCD. Private payers may simply refer to this type of limitation as a policy guideline or policy exclusion, or rider. So within these guidelines, payers may define where or when they will cover a specific service, but may limit coverage to specific diagnosis. So let's give an example. Insurance policies might have a wellness or preventative care benefit, but may only cover one such visit per year. Some payers may only reimburse for a single prostate-specific antigen test per year, a PSA test. The payer might require a documented screening diagnosis in coordination with that test. So if the patient underwent a PSA test in January of 2019 for screening, his insurance might not pay for another test until the next calendar year. However, what if the patient undergoes a PSA blood test for screening and the results are abnormal? And the doctor decides another PSA test is needed. Well, then the coder must submit a claim as a PSA blood test with the appropriate diagnosis for a sign, symptom, or an abnormality, not as a screening. Medical necessity continues to be open for interpretation by all parties involved. Many third-party payers have created lists or criteria they use to interpret medical necessity that you could always reference in the real world. And these lists do not necessarily reflect all options, but payers include this reference for their policy guidelines. Okay. Another thing to remember is documentation of all medical care should accurately reflect the need for and outcome of the treatment. So coders must understand the complex relationship between the physician, the patient, the medical record documentation, the coder, the biller, the insurance payer, and the communication by all these entities to successfully guide the interpretation of medical necessity. It is important to note that a diagnosis code should never be altered to match one of the diagnosis codes listed in a coverage policy as supporting medical necessity. The diagnosis code submitted must be supported and reflected in the medical documentation. It would be inappropriate to report a diagnosis just because it is on an approved list of diagnosis codes that meet medical necessity by a certain payer. Reporting a diagnosis that the patient does not have solely for the purpose of obtaining reimbursement or payment for service is considered fraud and will most likely result in fines and penalties, and even in some cases, criminal prosecution. So here it's important to remember their number one rule of coding. It's not documented, it didn't happen. A key to success, again, without a diagnosis code to indicate that a service was medically necessary, health insurance will not reimburse the healthcare provider for the procedure. Remember, the patient's diagnosis should always identify the reason why the patient is receiving healthcare services. If there is no medically necessary reason for the services, then the insurance company will not pay for them.